Care work is a vital part of our daily lives, encompassing everything from looking after children and the elderly to supporting those with illnesses or disabilities. But not all care work is treated the same. Some is paid, like nursing or childcare jobs, while much of it is unpaid, often done by family members at home. In this video, we'll explore the differences between unpaid and paid care work, why both are important, and how society values them. Let's begin by understanding what care work really means and why it matters to everyone, regardless of age or background. Unpaid care work refers to tasks like cooking, cleaning, and caring for children or elderly relatives, usually performed within the household. These activities are essential for the well-being of families and communities, yet they often go unrecognized and uncompensated. Most unpaid care work is carried out by women, which can limit their opportunities for paid employment and personal development. Despite its importance, unpaid care work is rarely included in economic statistics or policy discussions, making it invisible in many ways. Paid care work includes jobs where individuals are compensated for providing care services. These can range from professional roles like nurses, childcare workers, and home health aides to staff in elder care facilities. Paid care workers play a crucial role in supporting vulnerable populations and enabling others to participate in the workforce. Unlike unpaid care, these roles are recognized as formal employment, often with legal protections and in some cases benefit. However, paid care work is sometimes undervalued and underpaid compared to other professions. Paid care work can be seen in everyday life. For example, a mother preparing meals, a father helping with homework, or a sibling looking after a younger brother or sister. Grandparents may also provide regular childcare, allowing parents to work outside the home. These acts of care are crucial for family functioning, yet they are rarely compensated or formally acknowledged. The time and effort invested in unpaid care can be significant, sometimes amounting to several hours each day. Paid care work is visible in many settings, such as daycare centers, hospitals, and private homes. Childcare workers supervise and nurture children while parents are at work. Nurses and home health aides provide medical and personal care to the sick or elderly. These professionals are trained to handle specific needs and are compensated for their time and expertise. Paid care work is essential for those who require specialized support and for families who cannot provide all care themselves. Globally, women perform the majority of both unpaid and paid care work. This gender imbalance has deep roots in cultural expectations and social norms. Women are often expected to prioritize family responsibilities, which can limit their participation in the workforce or advancement in their careers. Even in paid care roles, women are overrepresented but often face lower wages and less job security. Addressing gender inequality in care work is key to achieving broader social and economic equality. Though unpaid care work is not included in traditional economic measures like GDP, its value is immense. If unpaid care were compensated at market rates, it would represent a significant portion of national economies. This hidden contribution supports the workforce by enabling others to work and participate in society. Recognizing the economic value of unpaid care is essential for creating fairer policies and better support systems for caregivers. Unpaid caregivers often face significant challenges. Balancing care responsibilities with paid work can be exhausting and stressful. Many caregivers lack access to support services, respite care, or financial assistance. This can lead to burnout, health problems, and reduced opportunities for personal growth. Society often overlooks the sacrifices made by unpaid caregivers, making it harder for them to seek help or recognition. Paid care workers also encounter difficulties. Many are employed in low-wage positions with limited benefits or job security. The physical and emotional demands of care work can be intense, leading to fatigue and stress. In some cases, care workers face discrimination or lack opportunities for advancement. Improving working conditions and pay for care professionals is crucial for attracting and retaining skilled workers. Despite its importance, care work, both paid and unpaid, is often undervalued in society. Many people take care work for granted, seeing it as a natural duty rather than a skilled contribution. This lack of recognition can affect caregivers' self-esteem and motivation. Raising awareness about the value of care work is essential for changing attitudes and ensuring caregivers receive the respect they deserve. Children benefit greatly from both unpaid and paid care work. Unpaid care from parents or relatives provides emotional support and stability, while paid caregivers in schools or daycare centers offer education and socialization. The quality and availability of care can shape a child's development, affecting their health, learning, and future opportunities. Ensuring all children have access to quality care is a shared responsibility. Elderly individuals often rely on both unpaid and paid care. Family members may provide daily assistance with meals, medication, or companionship, while professional caregivers offer medical and personal support. The availability and quality of care can greatly influence the well-being and independence of older adults. Societies with strong care systems help seniors live healthier, more fulfilling lives. Care work is closely linked to economic growth and stability. By supporting children, the elderly, and those with health needs, care workers enable others to participate in the workforce. This in turn boosts productivity and economic development. Investing in care infrastructure such as childcare centers and elder care services can create jobs and strengthen communities. Governments and organizations are beginning to recognize the importance of care work. Policies such as paid family leave, subsidized childcare, and caregiver support programs can help balance the demands of care and employment. By investing in care infrastructure and supporting caregivers, societies can promote gender equality and economic resilience. During crises like the COVID-19 pandemic, the importance of care work becomes even more apparent. Unpaid caregivers take on extra responsibilities, while paid care workers face increased risks and workloads. These challenging times highlight the need for better support systems and recognition for all caregivers. Many people juggle both paid employment and unpaid care responsibilities. This balancing act can be stressful and demanding, especially without adequate support. Flexible work arrangements, affordable care services, and supportive policies can help individuals manage their dual roles more effectively. Encouraging men to participate more in care work is essential for achieving gender equality. When men share caregiving responsibilities, it eases the burden on women and promotes healthier family dynamics. Changing social norms and providing parental leave for fathers can help shift attitudes and behaviors. Professional care workers often require specialized training to provide high-quality support. This includes learning about health and safety, communication skills, and emotional resilience. Ongoing education and certification can improve job satisfaction and the quality of care provided. Technology is playing a growing role in both paid and unpaid care work. From remote health monitoring to online support groups, digital tools can make caregiving more efficient and accessible. However, technology should complement, not replace, the human touch that is central to quality care. Different cultures have unique perspectives on care work. In some societies, caring for family members is seen as a moral duty, while others emphasize professional care services. These cultural attitudes influence how care work is valued and who is expected to perform it. Many paid care workers are migrants who move to other countries for employment. Migrant caregivers often face unique challenges, such as language barriers, separation from family, and uncertain legal status. Their contributions are vital to care systems worldwide, yet they may lack adequate protections or recognition. Engaging in paid care work can offer opportunities for social mobility, especially for women and migrants. However, low wages and limited career advancement can restrict upward movement. Investing in training and fair pay can help care workers achieve greater economic security and social status. Care work intersects with issues of gender, race, class, and immigration status. Women of color and migrant women are often overrepresented in low-paid care roles. Addressing intersectionality is important for creating fair and inclusive care systems that recognize diverse experiences and needs. Both unpaid and paid caregivers are at risk of mental health challenges due to stress, isolation, and emotional demands. Access to mental health support, counseling, and peer networks can make a significant difference in caregivers' well-being. Prioritizing mental health is essential for sustaining quality care. As populations age and family structures change, the demand for care work is expected to grow. Societies will need to adapt by investing in care infrastructure, supporting caregivers, and ensuring fair compensation. The future of care work depends on recognizing its value and addressing the challenges faced by caregivers. Promoting social justice in care work means ensuring that all caregivers, paid and unpaid, have access to fair wages, legal protections, and social recognition. Addressing inequalities in care work is essential for building more just and inclusive societies. In rural communities, access to paid care services may be limited, making unpaid care work even more critical. Families often rely on each other for support, and caregivers may face additional challenges due to isolation or lack of resources. Strengthening rural care systems is vital for community well-being. People with disabilities often require both unpaid and paid care. Family members may provide daily assistance, while professional caregivers offer specialized support. Ensuring accessible and inclusive care services is essential for the dignity and independence of people with disabilities. As populations age, the demand for both unpaid and paid care work increases. Societies must adapt by expanding care services, training more professionals, and supporting family caregivers. Planning for an aging population is crucial for maintaining quality of life for all generations. Education plays a key role in shaping attitudes toward care work. Teaching children about empathy, responsibility, and the value of caregiving can foster respect for both unpaid and paid care roles. Educational programs can also prepare future care professionals with the skills they need. Care work is closely linked to public health outcomes. Effective caregiving helps prevent illness, supports recovery, and promotes healthy lifestyles. Investing in care work is an investment in the health and well-being of entire communities. Balancing care responsibilities with other aspects of life can be challenging. Supportive workplaces, flexible schedules, and accessible care services can help individuals achieve a healthier work-life balance. This benefits not only caregivers but also employers and society as a whole. Urbanization changes the landscape of care work. In cities, paid care services are more available, but families may be more dispersed, increasing reliance on professional caregivers. Urban living can also create new challenges such as higher costs and less community support. Strong social networks can ease the burden of care work. Friends, neighbors, and community organizations can provide practical help and emotional support. Building supportive networks is key to sustaining caregivers and improving care quality. Volunteers play an important role in care work, offering their time and skills to support individuals and families. Volunteer caregivers can fill gaps in formal services and strengthen community bonds. Recognizing and supporting volunteers is essential for a robust care system. Advocacy is crucial for improving conditions for caregivers. By raising awareness, influencing policy, and mobilizing resources, advocates can help ensure that care work is valued and supported. Effective advocacy leads to better laws, funding, and recognition for caregivers. Innovation in care work includes new approaches, technologies, and services that improve efficiency and quality. From telehealth to community-based care models, innovation can make caregiving more accessible and effective. Encouraging creative solutions is vital for the future of care work. Environmental factors such as housing quality and access to green spaces can affect the quality of care work. Safe, comfortable environments support both caregivers and care recipients. Considering environmental needs is important for holistic care. Financial security is a major concern for both unpaid and paid caregivers. Unpaid caregivers may sacrifice income, while paid care workers often earn low wages. Providing financial support, benefits, and fair pay is essential for sustaining the care workforce. Legal rights for caregivers vary widely. Some countries offer strong protections while others provide little support. Ensuring legal rights for both paid and unpaid caregivers is crucial for their well-being and for the quality of care provided. Social protection measures such as pensions, health insurance, and paid leave can support caregivers and reduce their financial risks. Expanding social protection is key to building resilient care systems and supporting those who provide essential care. Community engagement strengthens care systems by involving local organizations, volunteers, and families. Collaborative efforts can fill gaps in formal services and create a sense of shared responsibility. Engaged communities are better equipped to support caregivers and those in need. Recognizing care work as a human right means ensuring that everyone has access to quality care and that caregivers are treated with dignity and respect. Human rights frameworks can guide policies and practices that support both care recipients and providers. Care work is central to achieving global development goals such as gender equality, health, and poverty reduction. Investing in care systems can drive progress across multiple areas, benefiting individuals, families, and societies worldwide. Unpaid and paid care work are both essential for healthy, functioning societies. Recognizing, supporting, and valuing all forms of care work is crucial for social justice, economic growth, and individual well-being. By working together, we can build a future where caregivers are respected, supported, and empowered to provide the care that everyone deserves.